All about bones. What are bones? Bone is made mostly of collagen, a protein that is woven into a flexible framework. Bone also contains calcium phosphate and calcium carbonate, minerals that add strength and harden the framework. The combination of calcium and collagen gives the bone its strength and flexibility. The flexibility, or ability to withstand stress, of the bone protects it from breaking. Bone is strong because of calcium, but bone also acts as a storehouse for calcium. In fact, more than 99% of the body's calcium is contained in the bones and teeth. The remaining 1% is in the blood. Bone changing cycle. During your life, your body continues to both reabsorb old bone and create new bone. Your entire skeleton is replaced about every 10 years, though this process slows as you get older. As long as your body has a good balance of new and old bone, your bones stay healthy and strong. Bone loss occurs when more old bone is reabsorbed than new bone is created. Anytime old bone is broken down faster than new bone is made, net bone loss occurs. Bone loss can lead to low bone density, osteopenia, weakness of the bone, and eventually osteoporosis. This can lead to bone fractures, broken bones, even with minimal trauma. What is osteoporosis? Osteoporosis is a disorder of the bones in which the bones become brittle, weak, and easily damaged or broken. A decrease in the mineralization and strength of the bones over time causes osteoporosis. Osteoporosis symptoms: fractures of the spine, vertebral, spinal, compression fractures are broken bones in the back that are due to weak bones caused by osteoporosis. The vertebrae, spinal bones, collapse as a result of even minor injuries related to falling, bending, twisting, or sneezing. As the bones of the spine lose their mineralization and strength, they can collapse, causing a hunched-over appearance, often referred to as a dowager hump. Stress fracture. Stress fractures occur in bones due to repetitive injuries, usually with minimal trauma. People with osteoporosis are more prone to stress fractures because of the weakness of their bones. Hip fracture. Those affected by osteoporosis are at greater risk for hip fractures. Even a simple fall can cause a hip fracture in a person with osteoporosis. Due to the weakness in the bones, these injuries may take a long time or be difficult to fully heal. Fracture of spine. Stress fracture. Hip fracture. What factor determines bone strength? Bone strength is related to bone mass density, which refers to the amount of mineralization remaining in bones as people age. The denser the bones, the stronger they are. Factors that determine bone strength include genetics, environment, medications, gender. Men have higher bone density than women. Aging. Bone density reaches its peak around age 25 and decreases after age 35. Why men have more bone density than women's? Menopause, estrogen. Women tend to be diagnosed with osteoporosis more often than men because once they reach menopause, estrogen levels decrease. Estrogen helps maintain bone density in women. Postmenopausal women can lose up to 20% of bone mass during the 5 to 7 years following menopause. Risk factor for developing osteoporosis. Risk factors for developing osteoporosis that cannot be controlled include female gender, family history. Risk factors for developing osteoporosis that can be controlled include smoking, lack of exercise, diets lacking calcium, poor nutrition, alcohol abuse. Additional risk factors for developing osteoporosis include medical conditions such as chronically low estrogen levels, vitamin D deficiency, hypothyroidism, inability to exercise, medications such as chemotherapy, corticosteroids, or seizure medications, hyperparathyroidism, loss of menstrual periods, amenorrhea, inability to absorb nutrients properly in the digestive tract. Prevention and treatment. Exercise. Exercise is important in helping improve muscle strength and balance, which can decrease falls and other accidents. Weight-bearing exercise also has the benefit of helping to strengthen bones. Weight-bearing exercises are activities in which your bones and muscles must work against gravity. Walking and working out with weights are two examples of weight-bearing exercises. Quit smoking and curtail alcohol. Smoking can result in bone loss. In people with osteoporosis, this can accelerate the progression of the disease. It also decreases estrogen levels in women, which can lead to earlier menopause and further bone loss. Calcium supplements. Calcium intake is important for strong and healthy bones. Adequate calcium intake must occur earlier in life to help prevent osteopenia and osteoporosis. Vitamin D. In order to properly absorb calcium in the diet and maintain good bone health, the body also needs vitamin D for the following: absorption of calcium from the intestines, prevention of osteomalacia, which can further weaken bones, increase bone density and decrease fractures in postmenopausal women. Thank you.